cancer of pancreas can cause diabetes and vice versa. The bidirectional interaction between pancreatic cancer and diabetes has been confirmed by epidemiological studies, which provide evidence-based medical support for further research into the mechanisms involved in the interaction. We reviewed the literature regarding the role of diabetes in the generation and progression of pancreatic cancer and the mechanism by which pancreatic cancer induces diabetes for its malignant progression. The effect of antidiabetic drugs on the occurrence and prognosis of pancreatic cancer was also reviewed. Diabetes may directly promote the progression of pancreatic cancer by pancreatic duct enlargement and hypertension, as well as by enabling an increased tumor volume. Furthermore, antidiabetic drugs can have different effects on the occurrence and prognosis of pancreatic cancer. The bidirectional interaction between pancreatic cancer and diabetes is involved in the occurrence, proliferation, invasion, metastasis and prognosis of pancreatic cancer with diabetes. The discovery of biomarkers for the early diagnosis of pancreatic cancer, as well as the novel usage of metformin for its antitumor effects and determining the potential mechanisms of these effects, may be the next direction for pancreatic cancer research and treatment. Diabetes and Cancer Risk, Oncologic Considerations, in the Journal of Het Hill, 2011 July 17 152 to 1144-55 by Rosta discusses the role of these two entities. Type 2 diabetes mellitus and malignant tumors are frequent diseases worldwide. The incidence of these two diseases is growing continuously and causes serious healthcare problem. Population-based epidemiologic studies show that the coexistence of type 2 diabetes and malignant tumors is more frequent than expected by the age-corrected incidence and prevalence of each disease. Studies show that type 2 diabetes increases the risk and tumor-specific mortality of certain cancers. The overlapping risk factors of the diseases suggest a relationship between type 2 diabetes and malignant tumors, with a significant role of obesity as a major risk factor. In the pathology of type 2 diabetes there are several processes, which may explain the higher cancer risk in type 2 diabetes. In vitro experiments, and in vivo animal studies show that the mitotic effect or cancer cell producing effect of high insulin levels that play an important role in the relationship of cancer and type 2 diabetes mellitus. Recent studies show that the different treatment modalities, antidiabetic drugs and their combinations used for the treatment of type 2 diabetes can modify cancer risk. The majority of the data show that metformin therapy decreases, while insulin secretagogue drugs slightly increase the risk of certain types of cancers in type 2 diabetes. Metformin can decrease cell proliferation and induce apoptosis in certain cancer cell lines. Endogenous and exogenous hyperinsulinemia may be mitogenic and may increase the risk of cancer in type 2 diabetes. Human studies show that the analog insulin glargine increases the risk of certain cancers. As a result of conceptual weaknesses in study design, data collection, and statistical methods, the results of these studies are questionable. The Rosta study results showing elevated mitogenic potential with some antidiabetic treatment modalities are not taken into account when considering the choice of antidiabetic treatment in type 2 diabetic patients. In the care of patients with increased cancer risk, oncologic considerations should be taken into account. More prospective studies would be necessary to demonstrate the possible correlation between treatment modalities of type 2 diabetes and change of cancer risk in type 2 diabetes mellitus. There is more information of cancer risk in this study called Increased Cancer-Related Mortality for Patients with Type 2 Diabetes Who Use Sulfonylureas or Insulin in Diabetes Care, 2006 by Boker et al.